check if it works. Does it work? It works. Good afternoon, everyone. I'd just like to begin by welcoming those members of the public or press who have joined us today, either in person or watching via the live stream, to this meeting of the Communities, Social Mobility and Inclusion Committee at Newshire Hall in Alconbury Weald. The County Council allows filming and photography at its public meetings, so feel free to take pictures to tweet or X or blog during the meeting. But can I please request that members of the committee and the public turn off their mobile phones or put them to silent or vibrate while the meeting is taking place. There's no fire alarm test scheduled for today, so if the alarm sounds, please leave by the nearest marked fire exit and assemble in the car park. So we'll go to item 1, which is apologies for absence and declarations of interest. Will the Democratic Services Officer report any apologies for absence?
Thank you, Chair. There are apologies from Councillor Batchelor, Councillor Costello and Councillor Gowings here as a sub, and Councillor Nethsinger with Councillor Van der Ven subbing.
Thank you very much, Nick. And does any... Oh, sorry, I do apologise. Do we have their hand up?
Yeah.
Yeah. Ian?
Sorry, Chair. Can I
That's fine. Go.
apologies for Councillor Billington, who's not well.
Thank you. Wish Councillor Billington a speedy recovery. Thank you, Ian. So does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? I see none. So we'll go to item 2, which is the minutes of our meeting held on the 17th of October. We're being asked to approve the minutes of that meeting as a true and correct record. Could I ask whether any member disagrees with the accuracy of those minutes? No. So on that basis, members are happy to approve those minutes. Thank you very much. And do officers or members have any comments on the minutes action log at all? Well, a few hands. So we'll start with Claire.
Thank you, Chair. So it's just a small point, and it's to do with the road closures for remembrance events. It says that the toolkit will be circulated to members when published in January. In the minutes, it notes that a draft was going to go to parish councils in November. Did that draft go out?
I'm going to check that with our Armed Forces Covenant Officer, Councillor Daunton. I know that the report is due to go out in January, but I'm not certain on the November point, so I will check that.
Yeah, yes, please, because I think it would be really useful to have the comments from the parish councils before it's finalised. Thanks.
Thank you, Claire. Good point. We'll go to Philippa and then Jeff.
Thank you, Chair. Number 180, it was a question regarding my concerns to do with advice given to the, usually widows, but I wouldn't like to assume that that's the only people who might be in financial difficulties when a joint bank account is closed when somebody dies. It says the opportunity exists, however, to support partners to service providers. I would quite like to know it was at least on our county council checklist, as it were, for our officers when they advise. So it will always be something brought up and not forgotten. So my question is this just an intention or is it a practice? Where it says that. Can you see on 180? Well, I was looking.
Actually, we've got Peter.
Yeah.
Peter with us in the room. Do you want to answer that, Peter, or do you want to do it as part of your presentation? Sorry to put you on the spot there.
We caught him. He was doing something else. That's all right. Sorry.
Well, Chair, happy to pick that up, but wasn't paying attention to the question, so you can repeat that, please.
I can quite understand that because you 100 on the action log, number 180, Mr. Gill, through you. We are stating what seems to be an intention to advise people, the bereaved. It's come to my attention that widows are who have been with joint accounts when their husband dies are in dire difficulty with delay. I'm not saying it's just widows. I'm sure it goes both ways nowadays. And I would like to feel that at least our officers always check that they realise that might be a problem, rather than an intention or an opportunity, which I think is the word used.
Yeah, I think just a supplementary question, if I may back, is that in relation to the registration of the coroner's service? The registration.
Yes, it's that opportunity. Yes. Can we make the most of it? Thank you.
Yeah, there's a lot that we can do in relation to registration services. I think the key, because that's just one aspect, there's a huge range of things that we could do. We have effectively a time slot in order to get through bookings and meet our statutory requirements in that respect. So what we do at the moment is provide a lot of information to signpost people to where they can get information on these factors. At the moment, we don't spend time going through that as a specific subject matter, and that's purely because of the time that we have available. And if without adding further appointments, we wouldn't be able to do that. And there would be probably a range of a whole other things that we could do if we wanted to. It doesn't mean in future that as a service we can't evolve that to incorporate those sort of elements, but obviously that needs to be factored in sort of a service redesign. So at the moment, what we have done is reached out to quite a few different bodies that provide support and information to people are coming and approaching the service, either at times we know there are going to be difficulties, so with a sort of bereaved families and friends, but also others that may just be because of the circumstances and the financial climate may be struggling. And what we can do is provide information. And if we do see someone in real crisis and they want to talk, is be able to make potentially calls through to others that may help. But I think it's not necessarily the answer you're looking for, but at the moment, I think based around what we have to do and the time we have, I think we're trying to do the best without a significant service redesign.
Okay, thank you. Does that answer your question, Philippa?
I'm afraid I'm not satisfied with that answer. I don't think we would be adding more than a couple of minutes to such a meeting. And I'm not saying that our officers should be held responsible for a whole lot of financial advice. But this particular one, particularly people who are relatively well off, so caught somebody out that it made me think this should not happen. If they've got lots of money in the bank, but they can't get hold of it, and it will not pay their standing orders, they could be an immediate, really serious problem.
Can I suggest we perhaps take
So-
this
and
offline? But I mean, thank
By
you for
all means,
highlighting
yes,
it.
but
Yeah,
if
thanks for
I would
highlighting.
like it to remain on the agenda. Thank you.
Okay, thank you. Really point, Jeff.
you, Chair. I'm referring to item minute number 176, and which concerns allergies. I'm banging on about allergies again. So Peter may well be able to answer this question. There is an answer. It's given an answer, but it's not actually the question that I asked, because the question I think I originally asked was the 30,000 grant going towards developing best practice for restaurants and non-packaged food, but somehow packaged food has been conflated in this answer. So we're talking about Natasha's Law, which is about packaged food and the labeling of that, which is one thing. Now, of course, the money was given in 2022 and had to be spent in 2023, so it predated our motion, the council motion on allergies. But while I'm asking the question, are we doing any work in order to promote best practice in allergy information in restaurants? So maybe that's not really the question about the minute per se, or the action log per se. I think it's an extension of it,
Peter's
because
gonna
it
come back
needs
on that.
clarification.
Yeah, I think Peter's going to come back and then we probably need to move on.
Yes, thank you for that, and thank you for your support around that subject matter, because it is something you're passionate about, and we are absolutely as a service. And you're absolutely right. There is a distinction here with what provisions exist at the moment between packaged goods and non. And the team have been promoting best practice outside of the current controls, and we know we're hoping for legislative change in that arena. The funding itself ultimately went to the bottom line, but we were doing work in that area anyway. And it's very much part of the prioritisation of the service with our food standards work going forward, because we continue to find evidence of problems around non-compliance in that area. And as we say, we continue to read articles in the media, for instances where people have had reactions because they're not getting the information that they should be getting. So yeah, we will continue to focus on that. And I would say that funding isn't dependent upon us working in that area or not. We will continue to do so anyway. So thank you.
Lisa just wants to comment.
Chair, if it's okay, I wanted to respond to Councillor Daunton's question, because I've had a note sent through to me. So it's just to confirm on the road closures and the toolkit. that the draft toolkit papers went to the Armed Forces Covenant Partnership Board in November, but they actually made some amendments, some suggested amendments. So those amendments have now been made, and then that document is going out to the parish councils that responded to the survey next week. So that will be in good time ahead of the January deadline. Okay. Thank you.
Thank you. Also, if there are no further questions on the minutes action log, I don't see any other hands up. We'll go to item 3, public questions and petitions. We've received no public questions or petitions for this meeting. So we'll go to item 4, which is the Citizens Advice Bureau grant. This is a key decision and it'll be presented by our Head of Communities, Jill Buckingham. Welcome, Jill.
Thank you. Thank you, Chair. Members will be familiar with the work and excellent reputation of Citizens Advice as the largest independent advice provider in the UK. National CAB's own research suggests that 40% of the British population will contact the service at some point, with demand for the service often greater than the resources available to meet the need. While Citizens Advice is a national charity, the local bureau are responsible for raising their own funding. The national organisation provides the framework for standards of advice and casework management, as well as a quality assurance process to ensure standards are met and maintained across the national network of local bureau. In Cambridgeshire, we're fortunate to have Cambridge and City CAB and Rural Cambridgeshire CAB, who work in partnership and between them cover the whole of the county. All paid staff and volunteers are fully trained and their work meets the advice quality standard. Since financial year 23-24, the council has grant funded the CAB to deliver a county-wide income maximisation service. The £400,000 grant this current financial year is paying for 8 specialist caseworkers to work with individuals and households who are particularly impacted by the ongoing increase in the cost of living. 4 of those caseworkers are based in the city and district, and the other 4 in rural CAB, so it's divided equally across the 2 bureaux. The caseworkers help clients to navigate the benefits system to ensure they're receiving their entitlements, and also look closely at their outgoings, helping clients to move onto utility social tariffs for available or renegotiate more manageable repayment terms when a household is in arrears or has debt. Typically, an income max caseworker can save every client approximately £400 per year. Members will note in 2.7 of the paper that between April 2023, when the income max work began, and September 24, when we wrote the paper, approximately 5,500 Cambridgeshire residents had accessed this service. The paper I'm bringing today is seeking your approval to continue to fund this important service at the current level for a further 2 years. The rationale behind the request for 2 years is because the value of the work is now established. Both CABs are employing trained and now experienced specialist staff to deliver this service, and offering this team job security for a further 2 years will help with staff retention and will provide some funding stability for both organisations. The recent announcement of the extension of the Household Support Fund means that HSF can fund the proposed grant next financial year, with the second year of the grant being funded from the anti-poverty budget. The income maximisation work aligns well with the values and ambitions of the council, and the data from this work will be provided as evidence to inform the work of the Cambridgeshire Poverty Commission. Consideration will be given to this when drawing up the detail of any grant agreement to be able to respond to any specific recommendations that come from that piece of work. Be very happy to take any questions.
Thank you, Jill. I wonder if you just clarify for us again where the money's coming from. Some from the Household Support Fund,
Yeah.
some from the anti-poverty.
That's right. So in the
budget.
first year, the money came from public health. This current year, it's coming from the Household Support Fund. We're allowed to use a proportion of it for prevention work. And then we know that the Household Support Fund is being extended into next year, so we can say that we can fund it again from there. So we're not touching the anti-poverty budget, the council's own money from that point of view, until the second year of the proposed 2-year period.
Thank you very much. Any other questions? Well, Steve, yeah, Steve, and then Susan.
Thank you, Chairman. Yes, I very much welcome the help that CAB provides and fully support us supporting them to do so. However, I'm disappointed in the package as presented, and I suppose it's around 3.4. The grant funds a holistic package of support, and there is no mention of public health within that. Now, 4 years ago, we were quite advanced with our proposals for anti-poverty. We were using the governance around the multi-agency governance around our response to COVID to lead this work. It's been replaced by the Anti-Poverty Commission, which I welcome. However, it's taken 4 years for that to happen, to replace what had gone before. And the learning from the work we did was that public health and poverty, our anti-poverty work, are intrinsically linked, whether it's alcohol, smoking, healthy eating. We just spoke to many social workers and early help colleagues who were talking about families who were spending a lot of money on ready meals, for example, when they could eat much healthier and cheaper if they, did their own food preparation, for example. And particularly now we've got the Anti-Poverty Commission, I would like to think that's the sort of thing they'll look at. We have a workshop next week. We've got the Commission reporting to us in February. So extending this seems a little bit cart before horse, because I would like us to understand what the Commission proposes, and I would like to see them think how public health is intrinsically linked with this, to see what proposals they have. Do they think this is the best package going forward? Because a holistic package to me would be advice on public health at the same time, face to face, rather than signposting. So hopefully Jill can perhaps explain a little bit more context, because if it isn't an intrinsically linked integrated package, then Chairman, I'd like us to delay this until after February when we see the report. I shall certainly make my views known at the workshop next week, as I'm sure other members will. Not sure all members have had the invite. So I don't know whether it just Spokes that had it or whether the whole committee. I think the
maybe
whole
we can put
committee
an
would be
advert.
helpful if they had the invite to the workshop. But
We can highlight this at the end of the item, but
Yeah,
the
okay,
workshop
fine.
as
so
Councillor
just
Goose
a
said
question,
earlier.
please, Chairman, around how integrated this is, because if it isn't, I would find it difficult to support in its current form, and would want to see what the Commission has to say before we extended it. And if the timelines didn't fit, could we extend this by 3 months, say, in order to consider the report fully in February before we extend this for 2 years? Thank you, Chairman.
Thank you, Steve. Jill, do you want to come back on that?
It's on now, isn't it? Yeah. I can provide assurance that Public Health have approved the paper. They asked asked for the second health inequalities are reduced in terms of how it met the ambitions of the council, and she fully supports, as do other colleagues within Public Health Way, that this is part of a wider package. You're absolutely right. There's lots of other things going on as well, and this is a standalone because it's a key decision about a grant rather than presenting the full package. But that work that you described that goes on in child and family centres around the slow cookers and the healthy eating, that's integrated with work with Cambridgeshire Skills, Public Health, and so on and so forth. So this is part, you're seeing this in isolation, but it is part of a much wider package.
So, Chairman, I think it would be helpful if the committee could see that wider package so we know what the full picture looks like. But I'm reassured by what Jill said. Thank you.
Thank you, Steve. Joe, if you could just switch your mic off and then we'll go to Sue. Thank you.
Thank you very much. Thank you, Councillor Criswell. I also wanted to say that because we're offering this as a grant, then we can actually put some grant conditions into that offer. And one of the grant conditions that we've already spoken about is that we need to be informed by the outcome of the Poverty Commission, and so that we can then work with the Citizens Advice Bureaus in order to take account of the recommendations that come out of that commission during the course of their grant, so that that too can be accommodated, that specific point in relation to the Commission. Thank you.
Thank you, Chairman. Thank you for that, Sue. So I'm just keen that once we get somebody face to face, we give them the whole package rather than signpost them to Public Health. That's all. Thank you.
Important point, Steve. Thank you for putting that. that forward. So I saw Susan next, and yeah, we got Philip and then Alex.
Thank you. Firstly, I have on my register of interest a non-pecuniary interest as a member of the North Hearts Citizens Advice. Sorry, does that work? A pedantic housekeeping comment. The recommendation is to approve a grant to the Citizens Advice Bureau. I think firstly, I don't think it's called Citizens Advice Bureau anymore. It's Citizens Advice, although the acronym still is CAB. So I think that needs correction, but also we need to specify which independent citizens advice organizations this grant is directed to. I mentioned my interest in North Hearts Citizens Advice because they do provide some support in Cambridgeshire. I know there is support in the division that I represent at the Melbourne Hub with their drop-in service, and they do support a number of South Cambs villages. And I presume that in other border-facing areas of the county, similar arrangements may be there. But I think the recommendation needs to be really clear about what's being offered. More substantially, I'm interested in Councillor Criswell's comments because it seems to me that there is a long-standing, almost embedded interest in the local authority, in the county council, and also in many of our district council partners to support citizens' advice for obvious reasons, because we work in such close collaboration in terms of our interests in income maximization and all kinds of support and accessing services that local authorities provide. So I think the paper, well, I really obviously welcome the support that's being offered. I think it's really important to state the context that, that supporting citizens' advice is a long-standing commitment of this council, and to just expand upon that a little bit. I wanted to ask to what extent, and again, this is follows on from Councillor Criswell's comment, to what extent we coordinate with our district partners who have the remit for benefits and so on. I know my own district is doing a lot of work on income maximization, and they have developed a tool for tracking low-income families that may be missing out on certain benefits. So there's a coordination, and I think again that goes to what Steve was talking about. And then finally, just to note, given our collaborative work across committees, that the Adults and Health Committee next week has a paper on charges review, which is largely also about income maximization. So there is that broad context. Thanks.
Do you want to respond, Jill?
Yes,
Yeah,
yes,
thanks.
absolutely. I mean, to go back to your very first point, Councillor, the bureau bit. Yes, it's confusing, isn't it? Because the shortened acronym is CAB, but they have dropped. However, our local CABs on the charities website, they're still officially called bureaus. So it is technically correct, although nationally it's now Citizens Advice. Absolutely, it's for the Cambridge City and District and the rural CABs. We can clarify that it is those two CABs that this funding supports. And although I do recognise that there are those border issues, and sometimes there's local funding arrangements with parish councils with different CABs to the ones that are the core for the county council for Cambridgeshire. The aligning support work with the districts, the way we work in partnership, yes, absolutely. We do that with a number of things, but we are all working together with the ICB as well around aligning all of our support to the voluntary sector, including to the citizens' advice. So that work is underway, and we work so closely with them around the anti-poverty work because of all our ongoing work with the Household Support Fund. So yes, thank you. Really good points. And thank you.
Okay, thank you. We've got Philippa, then Alex. Claire, did you also have your hand up? Yeah, and then Jeff. Okay, great.
Thank you, Chair. Mine's more of a comment. I warmly support any recommendation that offers security for further 2-year grant, because this is, we need to support the CABs in retaining highly trained and experienced staff to deliver the much needed support to Cambridgeshire residents. We've seen what can happen if people can't get that. Oh, I think of Disability Cambridgeshire, the sad loss of them, because this is a really skilled area, and we don't want our local citizens' advice, upon whom the councillors rely so greatly in just giving advice and casework. We want them to have that security, and we owe it to such important people, I think. Thank you.
Do you want to respond?
No,
yeah.
just thank
No,
you.
just
Welcome to
thank you.
support. Absolutely. Thank you.
Thanks, Philippa. So we'll go to Alex and then Claire.
Thank you, Chair. I think there's no doubt seeing the paper how effective this work is. Like, I think always we have the need for like vouchers. For example, I'm really glad we're able to have the free school meal vouchers, but it needs to be this work in actually addressing the root causes of poverty and to actually help maximize income. So I think it's really, really welcome. I was going to ask as well about, to what extent the Poverty Commission recommendations can actually change the details of the contract. I think this has been addressed already, but it would be good to see at a later stage, perhaps through a briefing to members or like a different update, to what extent can we actually change some of the work that is being done. Now, sometimes with some contracts, it's easier to be flexible than with others. So I want to know where we are on that. And for additional information for the near future, especially once we have those recommendations, I think it would be important to have an overview about how accessible the services are and how it connects to our community hub models and the development of work in libraries, and how which communities perhaps have easier access as opposed to those we need to invest more to have an easier access to citizens' advice services. And also to be interesting to know perhaps which groups are less likely to access citizens' advice income maximization work, and what can we do in that space, perhaps those who are less used to asking for support, and what can we do to encourage more residents to have this service as well. But this is probably for the future, but I'm reassured by the conversation. It is something we're looking at, and there is a degree of flexibility, even if we award this grants today, to be able to incorporate the Poverty Commission recommendations, which I think is really important, because the whole reason why we're doing the Poverty Commission recommendations is to have this lived experience and expert evidence to be able to then shape our decisions on how we're spending the anti-poverty funds. Thank you.
Thank you. Yes, really helpful suggestions. And in terms of the accessibility bit, we can definitely refine the reporting that we request from CAB through this. I can tell you that they do capture already some of the demographics of, and it's mostly working age. The working age population who access the support this way. We have a separate arrangement with Age UK, who are specialists in with older people. But yes, we can get more detail. We can drill down into more of that detail. It can also be informed by not only the Poverty Commission, but also the quality of life survey results that we have as well. And we can build into the terms and conditions that flexibility and that review once the recommendations have come through. So yes, thank you very much.
Okay, thank you. We've got Claire and then Jeff. Oops.
Thank you. I have two questions. One relates to paragraphs 3.1 and 3.2. It's obviously very valuable work that goes on in income maximisation, and as the report says, retaining highly trained and experienced staff. And I suppose I'm thinking ahead to when this grant runs out. Clearly, these people are doing good work. Why are we not can we not think ahead possibly and think about keeping them for a much longer period than that? And would it be possible to work across the county with districts to think about keeping the highly trained and experienced staff, not just for 2 years, but for several years and maybe even more permanently than that? So that's one question. And the second question is, I know from my time as district councillor in South Cambs that South Cambs has supported the CAB over many years. And we used to receive really interesting regular reports on the work of the CAB, whether we might receive reports from the CAB. Maybe we do and I've missed them, but I always found it really interesting and instructive to read the reports on the work done.
Thank you, Councillor Daunton. Yes, again, really helpful feedback and suggestions. In terms of the longer term, that would absolutely be our ambition, and this gives us that time to be able to do that planning. We don't know what else is going to come out from central government and so on, but this does buy us that time to plan. And again, it is around us aligning that support and looking how we all work together to that there's only one set of reporting, for example, that we all share, and it makes it more effective and efficient as well within the CAB. So yes, absolutely would want to do that. We do have some reporting that comes into us as officers, and we can talk to our CAB colleagues to have something that perhaps we bring regularly to spokes to be disseminated.
Thank you, Jeff.
Well, councillors along this road tend to think alike, and I had a very similar question actually. But I suppose the other aspect of this is I can see where the money's coming from or where the grant has been sourced from, but perhaps it's in the paper and perhaps I've missed it. Is it additional, or is it a replacement of an existing money that's given for this purpose? And, or, you know, how has it been funded up until now? And reporting a little bit more about perhaps the overall position, including the financial position of the CAB, would be very useful, because we can put that in context of the grant that is being proposed. Thank you.
Thank you. Now then, some of this is going to rely on historical facts that if I get this quite a little bit wrong, they'll be corrected. My understanding is that the income maximisation work is a new work stream that came along funded by ourselves to have that specialist workforce within the CAB. Both CABs have to organise their own funding. There's some money that comes nationally that they do some work on energy and some pension work, but everything else is gathered from essentially a patchwork of district parishes in terms of rural CAB and ourselves. So this was a new work stream and it was being tested for the first time. So they recruited the 8 staff and trained them up specifically for this work 2 years ago. So we're in the second year, and 5,500 people have been through. So it's it is meeting a need.
But the money is new. I mean, it's just continuing the work that we've already previously funded.
No, so the CAB, the CAB's holistic offer would have touched on some of it, but not having this specialist team that can go into the real scrutiny and detail of individuals' of personal accounts and expenditure, etc.
Thank you. I just have a question on the procurement. So we've taken legal advice, and it says the grant is not a subsidy, so there's no control issue. So it's not considered a grant. Could you just sort of briefly explain why that's the case then, and how they sort of reached that conclusion? Because we don't have to go through a procurement exercise for this, basically. That's the reason why.
No, that's right. So we've taken advice. So the Subsidy Control Act is something relatively new. So we had to run it past Pathfinder, and we have done on the previous occasions when we've granted like this, to just check that we're not giving somebody a competitive edge. So it's not really, appropriate in this context, but we still take the legal advice. They were very happy that it could be a grant. And as were procurement colleagues. I can't take you through the detail because I'm not a specialist, but we could go away and find that out if you wanted the real granular detail. But they were both satisfied, both Pathfinder and procurement, that what we're doing is correct.
That's fine. I mean, you don't need to go away and come back with all the various legal advice. I'm confident that we've got the correct advice and we followed it properly. So anybody else have a question? Steve?
Yes, thank you, Chairman. Very happy to support this, having had the reassurance from Jill about the integration with public health. Just a plea to Jill, I wonder if, to help us make the most of the workshop next week, whether we could have a 5-minute presentation on what a struggling family, what their experience would be if they presented for help, because knowing what that package is might help us just to understand where we might wish to make a contribution, if you like, to the work of the Commission. So I think that'd be helpful if that's possible.
That's a great idea.
Thank you.
Thank you. I will go back to the colleagues in PIC who are organising the workshop and get that in there. Thank you.
I wonder if we could just, as we said earlier, just advertise the workshop. It's next Friday, isn't it? 13th? Yeah.
It's Policy and Insight that are leading on that, so I'll check with Jo Lacey-Holland, the service director, the dates and the invites. Yeah, sorry, Steve, I couldn't answer your question because I'm not certain who they've gone to, but we'll get that out to everyone. Thank you.
So it's an online event, isn't it? So you can, yeah, I believe it's an online event, so no excuse for not attending. That's what I'm saying. Philippa.
This is a question, not a comment, Chair. Bearing in mind the crucial business of health inequalities and the fact that what money worries are very bad for your health in all sorts of ways, and they're corrosive, I would hope that maybe it's the workshop, maybe now Jill can tell us, where is it hard for our residents in the county to actually access advice from Citizens Advice? We've heard about South Cambs and I know a bit about the city, and I'm sure there's help from district councils elsewhere in the county. But are there any gaps? I'd like to know.
Thank you. I'm just wondering whether I could give you a broad answer, but the very specifics I would have to go back and ask colleagues. We certainly, the rural CAB has got the greater challenge, I would say, because it's covering 3 districts. City and district covers Cambridge City and South Cambs, and rural CAB covers Fenland, East Cambs and Hunts. So a lot of the offer is on the phone and digital, but obviously that has its own challenges. And there are also surgeries and drop-in sessions that are held around the county. And this is where I'm going to be really vague and say, I know they're around the county. They certainly use some of our libraries, but also use parish council offices and other areas. But I don't have a definitive list at my fingertips of where they are and where any gaps may be, but I can find that out.
I did wonder whether there are contributions coming in from all the district councils. I would hope so.
Thank you for. Sorry.
I will check that as well. And there are some parish and town councils who certainly do make small contributions on top of the districts, but I will get all of that information for you.
Thank you. For no further questions or comments, I think we're agreed on this. Happy to support this proposal. So to approve a grant of £800,000 to the Citizens Advice Bureau to deliver income maximisation across Cambridgeshire for the period April 2025 to March 2027. Does anybody disagree? I don't think they do. So I think we are agreed. So thank you very much. Thank you, Jill, for your time. Appreciate it. So we'll go to item 5, which is the Domestic Abuse Mobile Advocacy Service. This we will have to consider procurement here. This is for procurement of a domestic abuse mobility advocacy service, which will be presented by the interim head of service for domestic abuse and sexual violence, Julia Cullen. Welcome, Julia.
Thank you. So the paper that we're bringing to committee today is to approve the procurement of the domestic abuse mobile advocacy, sometimes called outreach service, and to delegate authority to award a contract for this service. So the outreach service is a key part of our safe accommodation strategy for victims of domestic abuse, which has been approved by the committee previously. It provides support for anyone experiencing domestic abuse in Cambridgeshire, including those who self-refer and seek support for themselves. The current contract expires at the end of September 2025. So the proposal within the paper is to procure a contract for 3.5 years with the option of 2 one-year extensions, and that would bring the contract in line with financial year boundaries so that we would then have a April start for any future contracts. The estimated value would be in the region of 250,000 per year, which brings the total to 1.375 million. The current contract that's already in place covers both Cambridgeshire and Peterborough and was previously procured as a joint contract across both local authorities. Following the decisions to separate many local authority services and to commission contracts separately across both of those local authorities, the proposal is now that the new contract would be a Cambridgeshire only contract. And that's really where we are with that. So I'm happy to take any questions.
Thank you. Claire.
Thank you very much for the paper. I'm really glad that there's an additional name to the service, outreach, because the name mobile is very confusing, mobility in inverted commas. So the outreach service, I think it's really great. And thank you very much for the paper. My question really is a very small one, and that's to do with 1.6. We've just been talking about the economic hardship, which the CAB supports, or dealing with the CAB supports. And I wonder, I hope that there is good relationship between the CAB and the outreach service, because 1.6 deals with the economic abuse, which very often forms part of domestic abuse. And it would just be really good to be reassured that there was good communication between the two organisations, always allowing for confidentiality.
Yes, absolutely. I think our outreach service and also our independent domestic violence advisor service, which is a service that sits in health, both link quite closely with citizens' advice when needed. We're aware that a lot of clients who are experiencing domestic abuse will need support around their finances. So we would link not just with citizens' advice, but very many other sources of support out there to provide financial hardship. In addition to that, one of the other parts of the safe accommodation strategy is around additional support that we can provide clients who might be experiencing particular hardship. So we have a small pot of funding that we will use for that purpose as well. But absolutely, we link with both citizens' advice and many other services out there.
Yes, Jeff, thanks. And then Philippa.
Thank you, Chair. I'm going to ask a question. I'm pretty sure I know what the answer will be or should be. I'm not asking it because I'm hypersensitive, because I've actually done some work, professional work in the area, but I'm assuming that the service will cover both men and women. As I say, I'm pretty sure that that was the case, but the paper does refer particularly to women in the case of economic abuse. I suppose that's less likely to happen, but men do actually get physical abuse, and sometimes they are very embarrassed to talk about it. So it's very important that they do have a forum in which they can discuss their issues and indeed receive protection when they need it. Thank you.
Absolutely. Hopefully I'm giving you the answer that you expected, that yes, absolutely is a service for men, women, and absolutely anybody who's experiencing domestic abuse can access that service. We often talk about women predominantly because it is a highly gendered issue, but depending on what statistics you look at, up to 1 in 6 men can also experience domestic abuse in their lifetimes as well. So any service will absolutely work with both sexes.
Okay, thank you. Philippa?
Thank you. And I welcome that answer to Councillor Seif's question, because although I can't find the photo, I do tend to take pictures of posters on the backs of toilet doors. Some of them are really good, and it's a good place to get these offers across. This is where the outreach needs to be. I haven't checked the back of men's toilet doors. But no, on a serious point, though, there does seem to be an increasing gender equality among younger people. From recent surveys, the number of young men who are suffering from what they've called violence within a relationship is increasing. So this is obviously something we need to look out for. And this sort of early help that doesn't require them to have crossed, the lines that make them absolute priority, that may well help them turn their lives around. And I do welcome this service, but I do hope it can be named appropriately, because mobile advocacy, you think like fish and chip van. No, it doesn't really work like that. So outreach is a good word to have in there when you're telling councillors about the service, because we need to know about it. Thank you.
Just to add that the term mobile advocacy is one that's really been used nationally around projects to support in that way. Locally, we do very much talk about outreach, and I would completely agree with you. It says what it is a lot better than using the term mobile advocacy.
Okay, thank you. Anybody else wish to comment or ask any questions on this? Ross, yeah.
It's just a quick comment, and it's about the poverty workshop, and just that a recent very serious domestic violence incident in my division, although not the root cause, but part of the story of what happened was significant financial pressures, and I guess understanding and being aware of the connection between domestic violence and financial pressures feels something that we should consider, although there is obviously a risk of making complicated issues ever more complicated. I'm not sure if there's a question there, but I guess it's something about where does this fit in with any kind of poverty commission strategy work?
Yeah, and I know the case that you're talking about, and I think one of the things that it's really important for us to remember that actually it's not always about people that we might perceive to be in poverty as well. Domestic abuse can happen to anybody in any walk of life, and that financial difficulties can happen to anybody in any walk of life as well. So yes, I agree. There absolutely is an intrinsic link, and we do work quite closely with organisations to ensure that we consider financial hardship and what is needed for anyone experiencing domestic abuse. We work quite closely with a national charity called Surviving Economic Abuse, which is sort of really key in terms of national drivers. They do work with banks, for example, around separating people's finances when they might separate from relationships and all of those elements as well, because money, sadly, is often a really difficult barrier to overcome.
Thank you. Sue wants to come in at this point, and then we'll go to Bryony.
Thank you. I just wanted to pick up the point about the Poverty Commission. Before the Poverty Commission got underway, in terms of taking evidence from a range of people, they also took advice from partners about how to frame the work of the Commission, because absolutely it's a very complex area. And so just to define what we mean by poverty and all the associated and interdependent factors that relate to poverty, but also relate to other areas such as domestic abuse. And now we're in the process of taking evidence. So I'm assured that we've done everything we can to try and bring to the fore from people for whom they've had experience of poverty, so that we can understand some of the complexities and the dynamics around that and consider that as part of the Commission. But yeah, absolutely. Thank you for raising that. Thank you.
Thank you both. Bryony.
Thank you. Obviously, I welcome this, not least because of the impact of domestic abuse on children. I have a slight query. In the executive summary, it says the service will commence on the 1st of October 2025, and it's expected to receive approximately 500 referrals a year. And then in 3.2, it says the aim is for the service to offer support to around 800 individuals each year. Where's the difference in the numbers coming from?
Just trying to find the right bit. So 500 referrals, but supporting 800 people. Yeah, I think that is an error, if I'm completely honest. We would expect them to be more referrals than actual people supported. Although obviously there is a overlap in terms of some people will continue to be supported for a longer period of time, so would still be supported when you get to the next reporting period. But that sounds like that's an error. Apologies, and that shouldn't have different figures. So we would be expecting in the region of supporting 500 people. 500 people.
Thank you.
Okay, thank you. Anyone else? That's all. I think we're done. Thank you very much, Julia, for your report and answering all the questions. So we've got two recommendations here. First, to approve the procurement of a domestic abuse mobility advocacy service, and B, delegate authority to the Executive Director of Strategy and Partnerships in consultation with the Chair and Vice Chair of this committee to award and execute a contract for the provision of domestic abuse mobile advocacy for a 3.5-year contract commencing on the 1st of October 2025 with 2 one-year extension periods. I think we're agreed on this. Anybody disagree? No, we will approve. Thank you very much. Thanks, Julia, and keep up all the great work. Thank you. And the next item is number 6, which is the Cambridgeshire and Peterborough Coroner Service Annual Report. That'll be presented by Service Director of Regulatory Services, Peter Gell, and the Head of Coroner and Registration Services, Sarah Abbott. So welcome, Peter and Sarah.
Thank you, Chair. Yeah, so the report that you have before you is one that you have annually, which is a reflection of the last sort of 12 months really of the service. And we've sort of focused within this on a number of areas, sort of trends, legislative reform, collaborative arrangements, sort of performance, finance and contracts. So really I think it's probably helpful just to reflect a bit around the sort of data and performance for you initially. So on a national scale, what we've seen are the referrals through to coronial services are down, but we have seen the complexity of those referrals increase. And that's largely attributable to the death certification sort of reforms which have rolled out the medical examiner scheme through sort of community settings where previously it was just in sort of hospital settings. And so that has increased the complexity. What we've also then seen as a result of those, there are more inquests now. And if you go back to 1995, since we've, so the numbers have increased significantly since that point. The inquest length as well as increased. So you can imagine with the complexity that takes longer. So it's not just the inquest, but the time taken from the start of a case to conclusion. And as a result, we're seeing more prevention of future death reports. These are the reports that the coroners write where there don't appear to have been sufficient progress to address and prevent future occurrences. So they feel necessity to write one of those reports. They are quite low in numbers nationally because during the course of investigation, if those bodies have an opportunity to influence change for the better to help prevent, if they're taking remedial actions at that stage, there is no need for a coroner to issue one of those reports. And also on a national scale, and it's something we've talked about here as a group before, is around suicides. And, which again, it's shown to have to say that the numbers are still increasing. It's been a concern historically, but they have increased. So the death certification reforms were quite a change as far as processes that impacted both on the coroner service and registration services. And there's a lot of work gone into that in order to make that as smooth transition as possible. What we've also seen, I suppose, locally, in contrast to cases taking longer, we've actually been able to reduce the length of our cases by 2 weeks. And that is nothing to do with our cases not being as complex. In fact, they are more complex than majority of jurisdictions because of the hospital settings that we have in our area. But that's really the focus that we have been taking as a service behind the scenes, looking at all aspects that lead from the start of the investigation to the conclusion to try and speed that up as far as getting that answer as soon as possible for those friends and family of the deceased, and it's something we will continue to do. As I said, the implementation of the reforms went well locally. As far as prevention of future death reforms, we issued 8 from our coroners in the last year, and that is an increase as we've seen nationally. So again, in tune. As far as some of the facts locally, just a few are pulled out here just to highlight, really. So we had 3 unlawful deaths last year within Cambridgeshire. There were none, I think it was the year before. Drugs deaths sort of increased. So it was a 23% increase, which again is significant. And suicides were up 9% within Cambridgeshire. Industrial deaths 8%. And one area which is so pleasing to mention is road traffic accident related referrals was down 3%. So that's somewhat indicative, I think, of the impacts that we are able to make in conjunction with the sort of, I suppose, a combined authority to our sort of road infrastructure and improvements going forward. As far as oversight, the chief coroner, so the national lead, has oversight around the coronial aspects of service delivery. To say they are judicial post holders, so although we provide the facilities and the staffing to support coroners, they make their decisions independently of the council. One thing I think which is key of the service is that the information we get and the findings of the coroners, it's really important that we take as much of that to help inform and prevent incidents in the future as possible. So the prevention of future death reports are just one area of those. But what we have highlighted within sort of 3.4 of the report itself are some of those bodies and groups that we collaborate with to share some of the data and information that helps inform their decisions on interventions they may wish to take going forward. And that's trying to use what are often really sad and very difficult circumstances for families to try and turn that into a positive in relation to how that information can be taken forward. And that is something we will continue to put our effort into and find further opportunities where possible to share that information. One area I wanted to highlight, I suppose, that has an impact on the effectiveness of the services around sort of the accommodation that we currently have. We know there is a significant sort of asset review of the authority, and you'll be very much aware of sort of proposals around disposal and maintaining assets and sort of the quality of the accommodation we want to retain. We are struggling with the current facilities that we have, both in terms of capacity, and this is in terms of Lawrence Court that we're talking about. It's a listed building. It wasn't designed to be used as a sort of a court facility. So we are in talks probably around finding some better accommodation currently within our own portfolio. That will be subject to sort of consultation. It will be subject to information coming before members. So there's only so much I can share at the moment, but really just the flag that we do need to find better accommodation. Also, since we last met, probably, I suppose, 12 months ago in this respect, that there's been a new national lead as far as the sort of the chief coroner. They're very much given a steer as wanting to see more inquests where possible in person. So you recall when we went back to the pandemic, more and more was being done online, but they're very much wanting to see the opportunity for people to come in person. And obviously having the limitations around capacity within our venues makes that more difficult. We are using the Peterborough Town Hall as well, and looking at the cases, 22% of our cases, we needed to use the Peterborough Town Hall as far as capacity. That's great. Well, we've got access to that, but again, there is a risk that we carry in relying on access to those facilities. What they do provide, though, at the moment is an opportunity for those inquests where require a jury to be able to use multiple rooms. So going forward, we're looking to build that capacity into the provision that we can offer more locally to ensure that we've got that in place. And the other area, just to highlight, and you may have seen on the news probably a couple of months ago now, was a case in Chelmsford. It went to court where 3 people were sent and had a criminal conviction, were sent to prison for trying to kidnap what was the coroner in Chelmsford. And on that occasion, the coroner managed to exit out of another exit rather than the same one that they entered. And I think the arrangements around the way that building was constructed enabled the coroner to remain safe. So we are doing a security sort of review around our own facilities. And as you would expect, that we do risk assess our particular cases, because some, due to the nature of some of those attending, will be a higher risk, as would with any setting, than others, just to make sure that we keep our staff, coroners, and anybody else attending safe, because there are occasions where there are conflicting parties that are coming to an inquest, that we need to make sure we manage that carefully. And I think some of these things we can improve the arrangements we have in place for the design of our future sort of accommodation. I think it's probably helpful if I sort of comment, I suppose, finance and contracts. We're never too far away from having to focus on finance, but what I would say is some of the procurements that we've undertaken over the last couple of years are really starting to demonstrate now best value in terms of the terms that we've used during those, are now ensuring we're avoiding cost escalation that we may have done in the past, to the extent that I think we've done our due diligence better than some of those providers. And I think we need to continue to do that to ensure that we're getting best value from the services that we do, whether it's our expert witnesses to the whole range of other providers that we work closely with. Going forward with Sarah Abbott in post, that we are looking whether there are sort of synergies across sort of registration of coroner service. So can we get more and do more from sort of synergies across those services, and more sort of efficiencies and closer working. So I think that's something that we'd hope to be able to report back to you in a number of months. And again, that's something we'll also, we do see opportunities in providing additional capacity through workforce development in our registration service as well, which is relevant to a question that was posed earlier today. So that's really just the highlight of some of the areas within the report. Happy to answer any questions. Thank you.
Thank you very much, Peter. Claire.
Thank you. Thank you very much, Peter, for a really good report. And I want to ask about the very startling figure on the increase, the highest total since 1995. And it's in the paper, and you've touched on it now. The detailed work that's going on to analyse why that's the case, and you mentioned that detailed work will be used to look forward. And I'm also there must be really tragic stories behind that. I'm also interested in it from a historian's point of view. So in the future, when people look back at this time, will the evidence be there in sufficient detail for people to interrogate that?
So for me, I think in relation to some of these changes are impacted on by the death certification reform. So I think that's my colleagues Sarah Abbott to talk about those, because actually that does very much change, as I say, the sort of cases that the coroners are seeing, and also we can add some more meat to the bone really in relation to why that is developing and changing some of those statistics that we've historically seen.
Thank you. So the first thing to say is that records are stored now electronically. The coroners do have to keep them for a significant length of time. So they are stored and all of the information is recorded there. Whereas previously it would have been what was in the inquest bundles themselves, which was quite limited. So the information is there. As to who has access to it, it is subject to coronial discretion. So it would be down to the coroners. Within our jurisdictions, our coroners are very keen on information sharing, particularly when it can, prevent for future deaths. So much of this partnership work has been down to coronial discretion and their willingness really to share information. So it is there, it is recorded, and it is accessible going forward.
Thank you. Anybody else? Philippa.
Thank you. And thank you for a report that reminds us of some of the things that our staff have to deal with. And although a tiny minority, there's considerable trauma involved in some of those, and we recognise that and we're grateful. This is a bit premature, but there are various aspects of the work of your department, Chair, the work of this department to do that will be, I think, possibly subject to change. If the bill on medically assisted dying goes through, I'm sure that we will be interested to have updates. I would certainly hope that the whole committee process will be involving the coronial service in considerable detail, because obviously there's a wealth of understanding there that they can draw on. in terms of the impact assessment, it would seem there's some things of your job is going to be easier and some not. And this will be reflected in some difference in the statistics, I suspect. It's been interesting to me to see that there's already legal involvement in individuals' end of life circumstances, shall we say. And so there is expertise there. And I do wonder whether things like what we hope will be more advanced decision making, advanced decisions being drawn up will help smooth things along and require less judgment on part of the coroners, who clearly have very complex things to decide about as well. This is not to suggest you can answer any questions now, but that I thought I would like to flag it up as something that I think will be of interest to this committee and local authorities generally, especially those dealing with health. Thank you.
Thank you. I would say it's very timely, actually. We were talking about that earlier, and I know Sarah this morning has been talking to one of our coroners about that. So absolutely, there will be significant change. We need to fully understand as the details as it comes forward and how that will impact, and it certainly will change, and that'd be something I think we need to come back to members here of the committee and explain what that means in terms of the service and the adaptations and things. But it will be probably an interesting, but also a challenging time, I would suspect.
Thank you, Jeff.
Thank you, Chair. This is not totally dissociated with what we were talking about in the first part of the meeting. You give us some stats on PFD reports. I can't remember now, 569, I think it was, nationally, and about 8 locally. That's a bare statistic. I'm much more interested in the outcome of those reports and to whether suggestions for legislative change or practical measures, whether it's on construction sites or whatever, have resulted from that. And indeed, whether we as a council and we as a committee should be taking things forward. Because if there are very important and certainly new things occurring, which a coroner has observed, what's the action being taken? I'm much more interested in that than the bare numbers. So I don't know if you can help me on that one.
Thank you. So when the coroners issue a prevention of future death report, one of the frustrations really is the lack of teeth. So the coroner can make recommendations to an organisation or an individual. They have 56 days to respond. If they don't respond, the coroner can chase, but they can't compel somebody to either respond or to take action. And that is, I think, one of the shortcomings perhaps of a PFD. Nationally, the worst responders to prevention of future death reports are local authorities, their councils. Within our jurisdiction, the response rate is 100%. So our local authority responds to 100% of the PFDs. They will talk about the measures that they have taken, the measures that perhaps they can't take, and the considerations. But they are very, very limited in terms of what they can enforce in truth. Quite depressing, actually. It's a powerful tool, but it does have its limitations.
I suppose just to add to that, there is a distinct difference between the provisions that are in place in the UK and Australia, where I believe they do have some teeth. So it's the way the legislation has set up that provision in this country. So as seriously as this council sort of takes it in any response, it's not necessarily reflective of all interested parties that receive such reports. So it is an area where there could be improvements, from being honest, because clearly the fact one of those prevention of future death reports has been raised, there were some serious questions to be asked and some real opportunity to make improvements to protect others in the future.
Service, but obviously you've got the background to all of these things and you see what the recommendations are. Do you just file it, or is that all you can do with it?
One of the things that the coroner can direct is that we have a wider circulation. So we will quite often send it to charities that are relevant to the particular topic as well. And publicity is powerful, and a lot of these organisations, there can be political pressure against them. So although I'm saying they lack teeth, they can still invoke change So I think it depends on the willingness of the organisation or the individual, the publicity around it, and the damage potentially reputationally if you don't do anything. So that they're not worthless, but I think they are limited in truth.
I suppose, again, just to add in relation to this authority, so should we be an interested party in Prevention of Future Death report, then that is taken really seriously by the authority, and you will have a exec director taking sort of responsibility for that with his or her management team, and there will be sort of an action plan in relation to that. So not only is there a timely response to the coroner in their judicial capacity, but the council does monitor that and take that through, and are very keen to have an early insight if there's anything that we can do from an intervention perspective as a local authority to know sooner rather than later. So we are sort of proactive in addressing that. So we're reassured from a sort of setting ourselves aside from the local authority, if that sense, from that things are in hand and we do take things seriously and improvements are made.
Okay. Thank you. I just have a quick question about the death certification reforms. I think you mentioned that, Peter, in your comments earlier. It seems to be that it's actually going quite well, that it hasn't generated the sort of problems that we thought it might. Just a question about the Harold, obviously relates to the Shipman inquiry, which was that quite recent? I know that of the case that happened in the mid-90s, didn't it? The inquiry was quite recent. Is that right? And what do you think the reasons are that's worked better than we thought, that it hasn't caused the sort of concerns that we thought it might?
Well, let's Sarah feedback on this only because she was heavily involved in the collaboration. Actually, it's really about the work prior to the implementation of working with partners, working through the potential areas of challenge, potential barriers, making sure we're sort of aligned. But probably Sarah, add more to that.
Thank you. So what we did from the outset, this legislation has been in the works and the change has been coming for a really long length of time. And we all knew it was coming and it was a case of when. So we knew and had identified really early on who the key partners were. Once the legislation and the implementation date was known, I brought together all of the regional partners to say, these are the statutory obligations that we all have, and these are the grey areas. And it was really a case of agreeing between us what we would do on those grey areas to make a process which suited all of the parties involved, because it couldn't be one that suited the coroners to the detriment of the medical examiners or the funeral directors or the police. It had to work for all of us. So we really tried to problem solve in truth and work cases through and say, if we had this particular case, what would it look like? Where could it get stuck? And what can we do to work around some of these problems? So lots of meetings, lots of trying to figure out where the sticking points would be and to work together with solutions, which really did put the families at the centre of everything that we were trying to do. So it was a very pragmatic, very family-focused rollout. And I think speaking to counterparts in other areas of the country, I think a lack of collaboration is where perhaps they've fallen down, where many services were thinking of their point of view and looking at it through their lens rather than to try and look at it quite holistically. So I think a holistic approach, putting the families at the centre and really trying to problem solve before the rollout is what made the difference.
Thank you very much, and well done for all that work. Anybody else at all? No. So we're asked to note the contents of the report, which we've done, and thank you for answering all of our questions. Greatly appreciated, but both of you, thank you. So we now move on to item 7, which is the Finance Monitoring Report for October 2024. That'll be presented by Head of Finance, Stephen Howarth. Welcome, Stephen.
Chair, and good afternoon, everybody. So this report presents the summary management accounts for period 7 for services within the remit of this committee, including revenue and capital items. So to very briefly summarise the position of those services, you'll see in the report there is a forecast revenue overspend of about £96,000, predominantly resulting from cessation of internal recharges for room hire within the library service. That links to the wider asset improvement programme, and ultimately this income budget we're expecting to be removed from the service. There's a forecast capital underspend of around £1.2 million, predominantly due to phasing of spend on the Priorities Fund, with that now expected to take place next year. I'll leave the intro there. Thank you, Chair.
Thank you, Stephen. Any questions at all? Claire?
Just if there's any more information on the Fenstanton Village Hall project.
Thank you, Councillor Daunton. Yeah, regular meetings are happening with Fenstanton around the Village Hall and the building that is proposed to begin in the spring. So the documents are currently with our legal team being worked up into grant agreements, and I don't know if Jill would like to come in at all, but a further meeting is planned just before Christmas. But the organisation have just gone out for quotes for the building and are in regular touch with us. And they've also provided us with a range of documents that were previously outstanding. So it's progressing, and the grant agreement will stipulate a start date of, I think it's mid-February next year. And from there, we will monitor it closely, but it's being tightly managed.
Thank you very much. Anybody else? No, thank you very much, Stephen. Appreciate your time. We'll now go on to the corporate performance report. This is item 8 for Q2, and that'll be presented by Sue.
Thank you very much, Chair. So yes, we have the Q2 performance report for this committee up to the period of the 30th of September of this year. In the cover report, you can see where we are in summary with the indicators, and it's good to see that we've got 9 green indicators, including active library users exceeding 100,000. So that's really good to see. And we continue to see success with Cambridgeshire Skills in terms of enrolments on their courses. We do have one red indicator, and we've seen this red indicator previously in this committee and have had questions around it. It does relate to deaths registered within 5 days. This indicator continues to move in the right direction, and you've got more detailed explanation around this indicator in the report. And obviously we've referred to that in previous committees, and so it is. We do have a response to some of the previous questions in the action log that's before the committee today as well. And the position now following recruitment is that further work will be done in the coming months to develop the skills across the team to ensure that the team is resilient. So the other thing that the report covers is the refreshed performance management framework. This was approved at Strategy, Resources and Performance at the end of October. And the purpose of that framework is to strengthen the consistency of performance reporting across all the council directorates, our management teams, and also the consistency of reporting through to policy and service committees. There's reference in the report to creating a balanced scorecard. So I just thought I'd describe what one of those is. It's really just a way of bringing together on a sort of into one place all our information about our workforce, our finances, our performance and our risks, so that we can see them together and better see the relationship between all of those different elements. Currently, you see those things separately in committee. So that's what we're working to do, to bring a scorecard together, which brings that information together in the future. And so in the future, the way you're seeing us report on indicators will change over time as we develop that work. In this committee, you've already done quite a lot of work on refining indicators and ensuring that they're relevant and that they reflect the work that this committee is overseeing. And that's why in 4.6, we do set out our initial list of indicators that you will be seeing coming through to the committee in the context of the new performance management framework. And as usual, you've got a paragraph in 5.1 that sets out the movements in various indicators since the last report. I do want to recommend the appendix to you because there's a lot of detailed commentary and quite interesting information associated with the indicators in the appendix as well. So happy to take any questions. Thank you.
Susan.
Thank you. Actually, it's about the appendix, and apologies as a substitute on this committee. I'm not as au fait as I should be. I just noticed on indicator 37, path to green, there's a note of the Warm Hub offer relaunching in November. And am I correct that the Warm Hub offer is ICB funded, or is that one of ours?
Thank you for the question. So this is in relation to the number of visits to library sites. Is that the correct indicator? Number 37?
Yeah, there's in the notes there under commentary, path to green, there's a note on the Warm Hub. It's not, I'm just curious whether references to Warm Hub offer refers to ICB or something else.
It's our own. So this is us publicising libraries as warm hubs, as venues for communities to use during the winter.
Okay, thanks.
Anybody else? Oh, sorry, Ross. Yeah.
Yeah, it's slightly tangential, but this is the Communities Committee. So under indicator 253, it looks at number of teenage volunteers, and I just wanted to make some comments, and there may be a question in there somewhere. So as a parent of 2 teenage children, I've found myself doing the County Council chaperone training, also Swim England training, both of which put lots of responsibilities on adults when taking responsibility for children, and both organisations seem to kind of look askance at the responsibilities the other organisation kind of suggests the way you should operate. So it's quite confusing. You know, some organisations say this is how you are responsible for children, and some organisations say this is how. And this certainly makes me the way in which I engage with teenage children who aren't my own. I certainly am very, very careful, which is probably a good place to be. But so that's the first bit of context. The second bit is that the village college in my village has had an amazing take up of Duke of Edinburgh. What this means is we have sort of 100 children wandering around wanting to be volunteers with like nowhere to go. And certainly some organisations with this kind of cautious approach, when a teenager comes along, kind of go, no, we don't have the resources to help with you or support you at all. And it feels as though, I don't know, is there somewhere on the County Council website which talks about volunteering and perhaps gives organisations a steer as to how they might support teenagers volunteering? Perhaps this is, I don't know if it's within the scope of the County Council or not. Possibly it is, but there seems to be a sort of general issue that if you are given responsibility for looking after children, you have lots and lots of kind of, if it's within a formal role, it's kind of strictly prescribed. If it's informal, it's far more loose. And I'm not saying that everything should be really, really tight, but a bit of guidance would probably be helpful, bearing in mind there are lots of teenagers who would like to volunteer.
Thank you. It's a brilliant question. And we are really keen to support young people into volunteering as well as our communities in general. So because of that, we've been doing some work with Support Cambridgeshire, so who hold the infrastructure contract for Cambridgeshire. And we've got a website that they have developed which encourages volunteering opportunities. It provides opportunities for local groups and organisations to advertise those opportunities. But they are now forming a group that can further progress that work specifically with young people in mind. So that work is being picked up. And we could certainly do a briefing note perhaps back to Spokes about that as it progresses, if that's helpful.
Could it possibly get circulated to everyone? That would be, to everyone on the committee, that would be really helpful.
Certainly. Yeah, thank you.
Thank you. Claire?
I've got 2 linked questions, both concerning libraries. One is the number of visits to the libraries which have gone up. Is it possible to flesh that out and know how many people is it that are visiting, because the libraries are hubs for non-library information or non-library use, and how many is it visiting the library per se? That's one question. And that's indicator 37. And on the next indicator, the indicator that Ros was just talking about, it would be brilliant to let the people involved in the Summer Reading Challenge have this, have these statistics. I think, people give up a lot of time and energy and commitment for the Summer Reading Challenge. So it'd be lovely to share this information with them. Maybe that's already planned, but if it's not, could it be? Thanks.
I'll just come in then on the library use. So my understanding is that the only data that we can pull through is the number of active library users and the footfall through the buildings, because of the way that the measures are counted at the door. However, we have got the annual library report coming in January, so hopefully that will flesh that out a little bit more and give a bit more context.
Ian. Yeah, go on.
Oh, sorry, certainly. I can check that with the service because we deliver the Summer Reading Challenge ourselves. And I know that from library visits that Sue and I have made, that the teams within the libraries are certainly talking about the successes of the programme. So it's certainly shared within the staff, but we could look at doing some wider comms as well. Yeah.
Thank you. Ian.
Thank you, Chair. It's just going back to libraries. From what you just said, Lisa, I'm now just slightly concerned. Does that include the attendance and numbers? Does that include those people that are using mobile libraries or not? Because I think if it doesn't, it would be useful for this committee to know going forward how many people are using mobile libraries. Thank you, Chair.
Thank you for that question. I will double check that with Gary Porter, the head of libraries, and we can certainly again make sure that that's in the annual report. And we can clarify I know that they do track the use of the mobile libraries. They know the regular attendees and how many resources are borrowed through them. So I'll check that in relation to this report as well.
Thank you very much. If there's nothing else on this item, we'll go to item 9, which is the committee agenda plan. Are there any updates to the agenda plan from officers or comments from members? Philippa.
Yes, I'd like to suggest that we have two things on some future agendas, maybe as a regular item if committee members agree. The first thing is to do with community safety. I'm nominated by this committee as the community safety champion, and I have found myself with a tremendous amount of help from Jill Buckingham and Lisa Riddle, sort of writing my own job description. And clearly there are great complexities to bring together what is happening county-wide, as well as with our neighbouring other counties. But I think what goes on in community safety and also on the community safety partnerships is of great interest to this committee. It certainly is part of the work areas that we deal with. And we've had example just now of the prevention of future deaths. I went along to the city one and there was a report in some detail, obviously confidential, where I'm glad to say that our local response to independent scrutiny did come up as they paid compliments to its transparency, so that's good to know. But more seriously, this is where it works through that connection with our responsibilities for the coroner. More light-hearted ones to do with what the work of Supported Cambridgeshire does, and we commission to do, work with young people, and as they get older is also something that comes up in community safety. So some sort of summary report would be useful, and I think of interest. People don't really like the to-note ones, but they can be very educational for us as councillors to find out about the work of the council as a whole. And you might find that some of the officers are quite interested to read them too, because it's one of these holistic approaches that we have in this committee. So that's one thing. Certainly, if you're going to appoint a community safety champion, you probably want to hear something from them, but more likely from the officers that are part of the team. And then the other thing is some sort of updates on how we are caring for our care leavers. We have resolved as a county to have this as a protected characteristic, and this is part of a national and international concern about the welfare of care leavers and how in many ways the disadvantages they may have started with do seem to dog them through adult life. So Cambridgeshire Skills, obviously, I'd like to know whether they are particularly understanding of issues to do with care leavers and aware of the problems that may be confronting them in taking up their offer. And that probably does possibly lead to a KPI, but they're a slightly questionable tool, I think, and income maximisation. Again, for care leavers, we know that we are providing, or certainly intending to provide, good financial advice to help them prepare for adulthood. And that presumably has an overlap with the sort of advice we are commissioning, as we heard this just now, from the Citizens Advice Service. Thank you. So I'd like to know what.
Okay, thank you. Lisa's going to come in at this point.
Thank you. So on the community safety point, I mean, firstly, thank you for acknowledging the work of the council and the district councils in that area, because I think it's a superb offer across the county, and it's doing some really good things. I will certainly liaise with Sue and with Chair, Vice Chair about how we could bring a report forward, perhaps for all members of the committee, and distribute something outside of here. In relation to care leavers, I think probably we would need to refer this to CYP for an update for Children's Young People Committee. But I can answer on the specific points of care leavers in relation to income maximisation, household support fund and skills. And on those points, I can reassure the committee that we work really closely with Elle Johnson, who is the lead officer. So she has been developing a programme of skills for care leavers alongside Cambridgeshire Skills, so very much targeting the work and the deliverables that they would like to see happen. And around things like income maximisation and the household support fund, officers, I believe, actually have met this week with Elle as well to make sure that we've got a bespoke package, financial package that goes in to support our care leavers. There's a lot of work that's happening in those places.
Thank you very much. Anybody else wish to comment? Susan and Steve.
Thanks. The January meeting, Closer to Communities, Evaluation and Recommendations, that is a paper that's going to be of real interest to the Children and Young People and Adults and Health Committees. I mean, all of our concerns around integrated neighborhoods and our collaborative working under the Integrated Care Partnership Health and Wellbeing Board. How are we going to capture the activity and learning? Where's that going to happen in the council? I've realized we have separate committees, but I'm looking at maybe Tom, because we're both in spokes perhaps with these other committees, or maybe officers have can advise as to how that work is being coordinated across. Thanks.
Thank you very much. And just to say, when you see the detail of the report when it comes through in January, you'll see that colleagues across the council are involved in different parts of the activity and different pilots. So certainly some of the integrated neighbourhoods work does appear in the care, the Closer to Communities pilots in some instances, and also working across with colleagues in children's services. So you ought to see that cross-working both within the council and with our partners reflected in those pilots. The assessment and the evaluation of those pilots, and certainly when it comes forward, also the recommendations about how the learning from those pilots is taken out across the council too. But certainly drawing attention to other committee members who have got an interest around that particular paper when it comes forward to this committee would be a helpful thing for us to do, really, because I think absolutely it's going to be of interest to a lot of people.
Okay, thank you, Steve.
Thank you, Chairman. Yes, just to support what Susan said, we've had the pilot things come to this committee, but we've not seen the bigger picture. So I think us grasping what the bigger picture for this proposal would be very valuable. Thank you. Yes, Chairman, the comment I was going to make is I note that the February meeting is right at the end of the month. Can we try and get the Anti-Poverty Commission's report to our meeting? Do you think that was due in February, we were told? It looks as if the next meeting after that is June, so it would be nice for this committee to see that report if we could. Thank you.
I'll take that away and talk to the people who are involved with the commission in terms of the detail of the timescale. But yes, thank you.
Thank you very much. Anybody else at all? No? Well, that is our last item on the agenda. So thank you very much for all your attendance. Our next meeting will be on the 16th of January 2025. So have a safe journey home, everyone. Thank you.